With Omicron so transmissible, some have assumed everyone will get the virus eventually and questioned whether safety precautions are worth it. What are the risks of that approach?
I totally understand this perspective and why people are asking this question, simply because we're seeing so many cases of COVID-19 during this Omicron surge. But I'll say a few things. One is getting infected with Omicron is not inevitable. Now, over time, most of us will be exposed to the SARS-CoV-2 virus if we haven't yet, but you really want to be fully vaccinated and boosted when you encounter this virus. It could still protect you from any infection, and it will definitely protect you from severe disease. So not a good idea to go out with no regard to being exposed to the virus. The second point I would make is everyone by now has heard about long COVID, and we know that infections are not always mild and self-limited, even with Omicron. Some people do get hospitalized, some people do get severely ill, and some people have symptoms that persist for long periods of time. You really want to avoid that if possible. And then lastly, I would say that for those who remember very early on, it seems forever ago now, early in the pandemic, we talked about crushing the curve. And what we meant there was if you have these very high peaks in infection, even with a variant that is less likely to lead to hospitalization, those really high numbers will still have the potential to overwhelm hospitals, because even if only 0.5% of the people who are infected require hospitalization, if you have 300 or 400% more cases, that's a lot of people who need hospitalization. So by taking these precautions, we can lower that peak and what we call crush the curve, and in that way also preserve the capacity of our healthcare system so that we can provide excellent care both to those who have COVID-19 and to those who have other life-threatening illnesses.